Good evening. Thank you for joining tonight's webinar, a one-year reflection on New Jersey's Medical Aid in Dying Act. The webinar you're viewing this evening is brought to you by Compassion and Choices. My name is Amanda Kavanaugh, and I am the campaign manager for Compassion and Choices New Jersey, as well as your host this evening. Before we get started today, please note that today's webinar is being recorded. Please also note that everyone is in view-only mode. This means both your audio and video functions are disabled and neither will appear in the recording. We will have a formal Q&A session both after the panelists speak and after we go over the tools that Compassion and Choices has to offer. To ask a question of today's panelists, type your question into the Q&A box on the screen and click send. Please note, if you don't want your name attached to the question in the Q&A box, you can check the Send Anonymously box. We will answer as many questions as we can during the designated time. As I mentioned, this webinar is brought to you by Compassion and Choices. We are the organization who's the nation's oldest, largest, and most active non-for-profit working to improve care, expand options, and empower everyone to chart their own end-of-life journey. We envision a society that affirms life and accepts the inevitability of death, embraces expanded options for compassionate dying, and empowers everyone to choose an end-of-life journey that reflects their values, priorities, and beliefs. Today's speakers are Susan Boyce, Dr. Deborah Pasick, and Deborah Dunn, registered nurse. We will cover how the law has affected and changed the life of these advocates, what we know thus far about the law, how it's worked, and also how you can find the care that you'd like at the end of your life. But first, we have a special speaker, and I'd like to turn it over to Assemblyman Berzicelli. Without him, this law wouldn't be possible. We thank you for your time, Assemblyman, and would love to hear a few words from you.
Well, first of all, good evening to everyone, especially the distinguished panel who I've come to know over this long haul. I think we worked collectively maybe almost 6 or 7 years. So your comments were very gracious towards me, but it was far from myself. It was a real team effort collectively. And we succeeded because we were, I thought, very measured and on the right side of the issue. And it was the right thing to do. And I feel strongly about it today as the first day that my staff brought it to my attention. And I tell the story because this time last year I was driving to Rhode Island for a vacation and had gotten the word that that lawsuit had been brought by the emergency room doctor, and they had a temporary stay. And so the Attorney General and the governor, actually the governor called personally, said, we will take care of this because it's the role of the Attorney General to defend the laws of the state of New Jersey, and talk directly to the Attorney General and then of course the team he assembled. But the story that stood out, that as he was putting the pieces together, I'd gotten a call from an individual who lived in Salem County. It was a hospice nurse who the individual had been planning to take advantage of this if in fact the law had passed, because he was in very, very difficult medical circumstances. And the hospice nurse called and said, you know, what do you think will happen? Because he was up against it time-wise. His situation was progressing that if it waited too long, he probably could not self-administer and would lose this choice. So I ended up speaking to the doctor and ended up speaking to his wife. And I say this to all of you because this puts a personal touch on things. So she explains to me, she's a devout Catholic, and this is not something that she believed in, but she had such love for her husband that she was willing to help him. And she wanted to hear from me what I thought the best case scenario was time-wise. And she was willing. I asked her, would you be willing to talk to the Attorney General's office, anonymously, of course, so you could tell the story of timing and how you could be irreparably harmed. Your husband could be irreparably harmed by not being able to access what was a legally passed law. And she did. And she, and her, not her name, not her husband's name, but was mentioned in the suit about why time was of the essence. And of course, in the end, the court agreed, and the appellate division was so sound and commented on how thorough the legislation was, because one of the arguments was that regulations had not been passed, and the judges essentially said, you don't need regulation. You can have it if you want to, but the legislation was so prescribed that it was just as clear as it could be. And here I fast forward. So going forward, everything gets resolved, the appellate division speaks, and I'm heading to my studio where I'm about to go to work when I leave this group here. I look down at my car at 6:15, and it comes to my thoughts, I have to call this person. I won't mention their name, and see how they made out. Did the husband rebound? Did they get a prescription? Did the doctor help them? I just didn't know. So I go about my business because I'm really rushed. And the next morning, before I could call, I get a call from the hospice nurse that the individual had passed away. So my first curiosity was, did God call him? Did he go naturally? Did he have medical aid in dying to ease his time? And finally, the nurse wouldn't tell me, and I didn't press her. But I talked to the doctor, and he said, "Look," he said, I can talk to you because the wife talked to you, so I can tell you, yes, he had assistance." So I talked about where he got the pharmaceutical, how it worked, and was curious about the timing. So he said, well, the first pill, he takes the first pill, then it's 15 minutes. They got a compounded drug from a pharmacy in Flemington, New Jersey. Price was very reasonable because that's an important thing we're going to talk about going forward. So I said, by the way, when did he start the process? He said he took the first pill at 6:15. That was the exact time I looked at my clock in the car, and she came to my thoughts that I said, I have to call her to see how things worked out. So I had been moved by that story since it occurred, told that to just a few people, spoke about publicly. And I knew at that point that everything was in balance. Everything was where it was supposed to be. And this firsthand story of how there was peace. And then I later spoke to the wife afterwards, and she gave me a little more detail. And she spoke with great term of relief of how beautiful the passing was. She was there with him in the bedroom, in their home. And in fact, our conversation, when I was talking to her, she was in that same bedroom. So to all of you, we did good work. And in that one particular case, I know some might be critical and say, well, it's only 12 people. It's not only 12 people. It's 12 people that found peace. It's 12 people that found a sense of control over their circumstances. And I would hope it's 12 people that are at eternal rest based on whatever their religious beliefs are. So to all of you, again, it's great work, my friends. And the patience, the battling, it really showed forward in how well the legislation was crafted. The court commented on that. So to everyone, just well done. And there's obviously and always more work to do. And I've said to everybody, none of us ever said that this was going to be the main choice. It was just the question of where the law should be and what choice people should have. And we have examples where people have found peace, and the law is working. I'm anxious for there to be more access. I'm anxious for end of care consultations to have a little more inclusion of this. I'm anxious for the Medical Society of New Jersey to come around. They're very close. They were within one vote of their board of directors to endorsing this. I can tell you personally that I've directed people there and they have directed people to other people to put people in touch. But right now it's a little bit hard to get to people. It's not easy. So, that's where our work has to come. So thank you for indulging me on that story. It is a true story. And I saw a real sign in that 6:15 moment of just a reassurance that the work we did was right.
Thank you so much for sharing that personal story, Assemblyman Berzicelli. And we know that this is such a busy, unprecedented, and unpredictable time for everyone. So we really appreciate you taking the time to join us this evening as we remark on our one-year anniversary. Your leadership is very much appreciated. Thank you. So now I'd like to head on over to our panelists, Susan Boyce, Dr. Pasek, and Debbie. Thank you so much for joining us this evening. We'll hop right into some questions. I know folks are anxious to hear these firsthand accounts about what this law really looks like. We'll start off with probably the most interesting question of all. How has your life changed since the passage of the medical aid in dying law? And Susan, I'd like to hear from you first.
Thanks. Well, obviously, at the very beginning, when the law was passed, it's hard for me to describe my sense of relief that I felt upon passage. I mean, I did not realize, not just because of the hard fight that we had to put up, but because it lifted a burden off my shoulders. I knew I would have an opportunity when my time comes, if I'm appropriate for the bill, I would have my chance to do what I wanted at the very end. And being free of that was thrilling and it gave me space that I could just say, okay, all this worry I've been carrying, I can put that over here now. we're not there. I'm not yet ready to access the bill, but when I get there, it's going to be there. And so for me, it's been enormous relief.
Thank you. Dr. Pasek, what have you felt in the last year since the law has passed?
Well, interestingly enough, my first emotions were actually exactly like Susan's. I'm not ill, but I've entered my 7th decade. And when one, reaches a certain age, you kind of start to realize your own mortality. And just knowing that this law is available to me, should I ever need it, gave me the same feeling that Susan had, this feeling of just relief and space, that I could go on with my life, but that there was one major thing that I did not have to worry about. Because I don't think that most of us fear death itself. Most of us fear the pain and suffering that might come before it. And it's a huge burden to be lifted from everybody's shoulders. And that was my initial reaction. As professionally, I did not start out thinking that I was going to be a prescriber. My practice as a rheumatologist didn't have me encounter many terminally ill patients, and I naively thought that physicians would take care of their own. When it became apparent that physicians were not forthcoming, they were hesitant. There were not a lot of physicians that were willing to prescribe, at least at the beginning. I realized that all the advocacy that I had felt and everything that I had put into getting the law passed, I felt that it was my duty to just switch gears in my practice and become an actual prescriber provider. So that's been a change in my professional life as well.
For me, I found I wasn't looking for medical aid in dying for myself. My husband had passed away, and watching him go through death was so horrendous and horrific that I went looking for something and found Compassion and Choices, and has been volunteering for it for 6 years. Now it's 7 years. I am looking to do more work about Compassion and Choices, medical aid in dying, about the law in New Jersey. So I'm looking to work with hospice group nurses in educating them. I find you need to educate one-on-one, one person at a time, or a small handful at a time, because it's a 20, 30-minute conversation. It is not a fast 1, 2, 3 conversation. I get it. Have a nice day. It takes a lot of time and energy. And the one-on-one communication is very important to get the points across and to make people understand that it's not about what they may think, but it's about what your loved one may want, and to try to understand that. So the best people that I want to go to talk to are the nurses. I think physicians and nurses, the healthcare providers, need to, at the very minimum, understand what medical aid in dying in New Jersey means. Because if a patient is interested in talking about it, no healthcare provider has the right to say, oh, I don't believe in that, and walk away. Healthcare providers all must provide information and talk to the patients, and if they don't feel they're comfortable to do that, that's fine, but they have to then pass the patient on to somebody who will pick up the ball and talk to them. That we can't just walk away. That's called patient advocacy. So that's where my main thrust is right now, is moving the ball forward.
Thank you all for sharing those personal experiences about the past first year. I'm curious to know, have you heard more discussions around you about planning for end of life care? And similarly, how has the conversation around you changed? And Debbie, I think let's start with you. You're a nurse, you're in the field having these conversations.
Yes, so I work in a hospital, but I don't take care of patients. I'm an educator. So I take care of the education required by the nurses in the hospital. But during COVID, which coronavirus is a huge thing that's ongoing, there's no end to it right now. But the first 3 months of it, New Jersey was very heavily hit, just like New York. So we saw a lot of patients succumbing to the disease. During that time period, I also was talking to a lot of family members who were not sure what the patient or their family member would have wanted. You know, go on the ventilator, don't go on the ventilator. When do you pull the cord if you're going to pull the cord, if that's something that's on your agenda. And if people don't have an advance directive, which a lot of people do not, then the loved ones who are making the decisions when the person who's ill can't make the decisions for themselves or speak up for themselves, the loved one is left holding this bag and not knowing what to do for their loved one. So that whole crisis has brought to a head the need for advance directives. So along with talking to hospice nurses, and any nurse who will talk to me, I also want to advocate more for advance directives. Advance directives, I know, did go up after the major hit of coronavirus because people realized they didn't know what they wanted and they didn't put it in paper or choose a healthcare proxy. And so family members were not sure what the right answer was for their loved one, which is a hard place to be as well. So that's what I experienced in the last few months. And certainly end of life is a very important topic regarding coronavirus. Because if you get the life-threatening mutation of it, because there's different mutations now, and your life is at risk, you really need to have all these ducks in a row so that you have what you want at the end when you can't speak for yourself.
Thank you for that insight. Dr. Pasek, you're a physician, so how has the conversation around you changed in the past year now that medical aid in dying is accessible?
So I've always talked about end of life planning with pretty much all my patients when they want to discuss it, and even when they don't want to discuss it. And I agree with Deborah. I think that the big change was not really, a year ago when medical aid in dying was passed, but really the big change in discussions happened with the onset of coronavirus. Interestingly, we did notice an uptick in patients requesting medical aid in dying since March. And we were curious as to whether it was specifically due to COVID, and the fact that people are thinking more about having control over their end of life should they contract COVID. But in practically speaking, I began asking patients when they came in for medical aid in dying consultations, and they really were not thinking about COVID in that sense. It was just part of their same discussion that they've always had. So I don't think that COVID has really affected that subset of population for medical aid in dying. I think that people just are becoming more aware of it, and just the natural progression of things over this past year is that more people are taking advantage of the law.
Great. Susan, was there anything you wanted to add? I know you have a lot of connections, unfortunately, other friends who are terminal. Has the law provided more of an open forum to have conversations around death and dying? Have you seen any differences?
Yeah, excuse me. Yes, I have. I think both, yes. People approach me all the time because they recognize me from things that I've done in the media. People approach me all the time. I can stand in the grocery store and have somebody, well, back before COVID, I could stand in the grocery store. But I would have people approach me and want to talk about it. And I think the message that they should get their end of life paperwork in order is something that I'm going to take on as part of the mission of spreading the word, because I think COVID has certainly woken a lot of people up, but it's definitely something we need to take seriously. And I welcome people approaching me in the grocery store wanting to talk about it, because it gives us a chance to educate. And everybody comes, the people who come up to me and want to talk to me are doing it because they're openly interested, and that's good to see.
Well, thanks for having an approachable, friendly face that people want to ask you, right? Yeah, so on to the next question. have you ever heard of or experienced any barriers in accessing the law? And sort of, again, piggybacking, it's hard to have a conversation about end-of-life care without mentioning the coronavirus. Has COVID changed the way that providers are really delivering healthcare in New Jersey? And I think we'll kick that over to our healthcare provider on the line.
So the short answer is that the state, the various medical institutions, the insurance carriers, they all came together very quickly in outlining a new way of delivering healthcare in these times of COVID that is safe and effective, and a combination of very judicious in-person visits with incredible amounts of safety and cleanliness and social distancing, and then the availability of telemedicine that definitely helped people access care without that we're afraid to go out and probably should not have been going out. So not just with medical aid and dying, but all of medical care. I think things went fairly smoothly from the beginning, and we've been able to continue to provide medical care with very few glitches to our patients. So it hasn't been particularly frustrating. It's been it's worked very well.
So I know one barrier can be affordability or access of the medication. Deborah, do you want to talk about that at all? Have you heard of any other barriers other than those things?
Well, I don't deal with people at end of life. Being an OR nurse, we do surgery, so it's to keep people living. So I can't speak about that end of it, but I can speak about the telehealth piece. I think that what happened with coronavirus, it brought telehealth finally into the 21st century. It's been on the table for a very long time. It's been talked about forever, and it finally put it on the map. From a perspective of somebody who's terminally ill, I think it's important because to go to a doctor's office when you're at the end of your life is incredibly difficult. And so I share a story of my husband when he had TPN, which is nutrition he got through an IV into a central line because he couldn't eat anything. But that's ordered by prescription by a doctor with certain vitamins, minerals, and every week it changes. So we actually had to go to the doctor's office. The effort required for my husband to get to the doctor's office and come back home was astronomical. So if nothing else, telehealth, should it stay around, which I hope it does when COVID goes away, will hopefully help people who are terminally ill who get into a doctor and they don't need to be seen in terms of being touched and having a stethoscope put on them or a blood pressure cuff. But if they just need to talk to their doctor, they could do it by telehealth, which is a huge game changer for people at the end of their lives to conserve their energy for staying at home. So I see that as a very big plus. Also, starting to use iPads in the ER when patients couldn't see their family members and they didn't know if this was goodbye. So bringing iPads into the hospital environment, having doctors on a regular daily basis calling family members, that usually doesn't happen. But that was happening in our institution because we made it happen. So all these things that came out of coronavirus are very good things to use for medical aid in dying down the road. Hopefully it'll be legislated that we can use these devices, with HIPAA and making sure nobody's, privacy is kept and all that. That's a big part of it as well.
I think that the biggest barrier still to date is accessing a prescribing physician, because there is no list. Nobody really wants to be on a published list on the internet. But we are slowly developing a network, both amongst ourselves, the prescribers, and institutions are also developing their own networks. So it's a matter of just knowing who to call and how to access, and that's a very big question mark of how to do it effectively and available to whoever wants it. And that's something that I am going to try to devote my time, now that I'm retired from my practice, into developing a New Jersey-based organization that will be based on volunteers, people that will help patients get access. Will know what calls to make, who to call, who to access, just how to make themselves available to this network that is definitely there, but it's just kind of nebulous as far as how to get it.
All right, so I have one more question that I'm going to ask the panelists, but I want just to send a quick reminder, if you have a question to ask the panelists, we're going to open it up to the audience shortly here. Just type it in the Q&A box on the bottom of your screen, and I'll answer it momentarily. But you know, folks in New York and Massachusetts and places are looking at New Jersey, and they're so envious that you have this law. And those who might not have been in on the medical aid and dying movement over the last 20 years think this just happened in New Jersey, and they want to know, how did you get it done? And if you had to give a piece of advice to advocates in other states that might not have a law, what would you say to those folks? And Dr. Pasek, we'll start with you.
Well, I think first of all, my advice to those people is to find themselves a congressman or assemblyman or a lawmaker in their state government that is as passionate about this law as Congressman Berzicelli, Assemblyman Berzicelli. Because I think that is just so key. I think that the passion has to start there, and then you build your coalition from that. I think physicians need to get involved, need to speak their mind in support and tell their stories. I mean, I know that there are terminally ill patients and people that have lost loved ones. Physicians have seen so much death and dying that I think that our voices can paint a very formidable picture to the lawmakers as to what death and dying is really it really is about, as far as the suffering, the actual suffering that is involved. So my advice would be to push your physicians to get involved and find yourself a passionate lawmaker to be on your side.
Great advice. Susan, what would you say?
I guess I would say that as a patient, I got involved in this because I heard that it was potential and I got excited. I had no idea what I was getting into. I thought it was going to be 1 year. It turned out for me, I think I was involved for 5 years, and it's a good fight. But it's not a quick and easy fight. And so I would, I find good people to work with, like the team that we had, and keep chipping away at it, because I think that's what it this felt like. That's what it took from my perspective. And I don't, try to influence lawmakers every day. So this was a new experience for me. I'm so fortunate that we passed this law. I remember the feeling of feeling envious of the Californians. And so New York and Massachusetts, I sure hope that you can get this passed too.
That's great advice. You never know, right? What is going to be the final push over the edge, and then you have it. Debbie, any advice that you would pass along to the other states?
Yeah, I have two things to say. One is having people involved in each state who have personal stories to share. Personal stories resonate. They make a difference. I actually was lobbying in the hallway in Trenton. They don't have offices, so we have to catch the assemblymen as they're walking through. And so we stopped one of them, and then somebody pulled me over from Compassion and Choices to talk to him. I spent about 20 minutes. He was on the stairwell, on his way down the stairwell, and they grabbed him. And I was talking to him about my husband and why I'm for this. And he raised a lot of good questions, and we spoke about it. He walked away from me saying he was going to vote yes. So that 20-minute conversation occurred in a hallway with the legislators who were able to stop and listen to hear what you have to say. If your legislators have offices, which mine does in Fair Lawn next door to me, I was there 3 times talking to him. So you have to go out and about with Compassion and Choices. They have people that will go with you as well, or on your own. You have to write letters, and you have to go to the Capitol in your state and be there on a regular basis. And it's pure perseverance, truly 100% perseverance. I'm not an advocate. I'm not an activist. I'm not political. I'm not into any of that stuff. But when my husband died, I said, this is not okay. And I got on the bandwagon, and I've actually become an activist for the first time in my life. And this is what I'm an activist for. And it requires a lot of energy. I've been doing this with Compassion and Choices, like I said in the beginning, 6 years to get the bill passed into law. And then this past year that we're celebrating the anniversary now. So keep going at it and don't give up.
Let me add, if I may, and then I have to step away. I found as we all got to know each other, and as this discussion advanced, and we must always remember to be grateful to Governor Murphy for being willing to sign it, because we had the votes and we just didn't have a willing governor. We could have got it done a few years sooner, and that was just where we were. But I think that some advice that I would offer is that when you're talking to those that are against it, meaning legislators who have yet either to make up their mind or against it, I found it very effective and important to decouple their personal beliefs and remind them of the people they represented, and that their personal beliefs may not align with what their constituent may want. And that's an important distinction to make. Because, people have asked me repeatedly, what choice would I make? And, I've said, I don't know what choice I'll make. And hopefully I'm not going to have to do that tomorrow. And maybe, who knows what happens. But, I felt my discussion would be, where should the law be? So when talking to people who are not favorable, especially if you're someone from out of state is listening to this, and you're working with a legislator who says, oh, well, my faith doesn't let me do that. First of all, I have to respect that. And you have to remind them that you're not asking them what they would do. You have to remind them to talk to the people they represent and get a sense of what they would like the law to be and how the law should read, which is what we all collectively did. We simply established where the law in New Jersey would be. We never advocated for someone to do anything other than to say, structure of the law should be in a position that if a person wants to make a choice in this type of determination, end of life choice, they should have the ability to do it in a safe way, in a structure that they can be among trusted people, and they can make that kind of choice. And we eventually won the day. So the key is to be persistent, as the others have mentioned, but just to remember that the person you're talking to who is against it is a person too. And the key is, if you're dealing with a person who is a lawmaker, you just have to move them along a bit and remind them that they represent people. The states are representative form of governments. They're not, I represent 220,000 people. So, and I remember, and I'll just leave you on this, I have people say, well, you can't advance this. Your aunt is a Roman Catholic nun. You were raised a Catholic. And I reminded everyone that my personal religious beliefs were mine. And, I'm a legislator, happens to be a Catholic. I'm not a Catholic legislator. And I had great conversations with bishops and different and leaders of all denominations. Wonderful conversations where we reached an accord of respect that this is about choice. And I remember one of the prominent religious leaders in New Jersey said, well, after this passes, and at that point he had conceded it would likely pass, it will continue to teach our flock as we believe the scripture directs us to teach them. That's the right answer, because we didn't tell him to change. We didn't tell him to stop advocating for what that religious belief is. We just clarified where the law should be. And in New Jersey, the law is very simple. Person has a right of self-determination, can choose to ask for medical aid in dying if that individual is terminally ill. It's not very complicated. So advice to anyone, be respectful of the people that oppose you, recognize they have feelings. And if it's legislature in New Jersey, our formula is real simple. 3 numbers, I always said, 41, 21, and 1. We needed 21 votes in the Senate, 41 votes in the Assembly, and 1 governor's signature. 41, 21, and 1. And you know what? In the end, we got 41, 21, and 1. Although I tell you, there was 47 votes in the Assembly, but we got 41, 21, and 1. So thank you to everybody, by the way, and keep advocating. Be respectful of those who are in opposition, because you know, in the end, right is might. And this argument was won on the merit, and the law in New Jersey is clear. Thank you, everyone. I have to step aside. Be well, everybody.
Thank you so much, Assemblyman. We appreciate your time. Have a great evening. And thank you so much to our panelists. It's time to turn it over to the audience for a few questions. And I just want to make a note that once I'm done with these questions, I'm going to go over the current report of the 6 months of utilization, as well as how to access medical aid in dying, what resources we have available. So if I skip your question right now, it's just because I'm going to be covering it in just a few moments. So I want to start with the first question that I saw here right from the beginning. Bear with me. And it is, for a person who elects hospice and meets the medical aid in dying requirements, if the attending prescribing physician is comfortable with medical aid in dying, can the hospice medical director be the consulting physician? Dr. Pasek, can you answer that one? Can a hospice medical director be the consulting physician? I think is the bottom line.
That's a good question. My knee-jerk reaction is yes, but I don't know if there is a rule that precludes that. So I would have to get back to you on that one. I'm not sure.
Okay. Yeah, if that person wants to send it. Nothing that I'm aware of says that they can't be. Deborah, do you know anything different?
I don't know the answer to the question either, but I do know that if you are working for an organization, the organization's umbrella as what can be, what they consider appropriate care in their facility is relevant. So it depends on where the person's working also. As far as the law is concerned, I think it's just 2 physicians. It doesn't say what kind of physicians, but I think it would depend on the facility where the patient is located and what that facility is saying about the topic.
Right, fair. I think that to be true as well. Yeah, so to the person, because they had a second question that was for a person who elects hospice and meets the medical aid in dying requirements, if the attending physician is not comfortable with prescribing medical aid in dying, can the hospice medical director become the prescribing physician and then refer to a consulting physician? I think if you could send an email, we can follow up and get those specific answers for you. And the easiest to do that is just nj@compassionandchoices.org, and we can make sure that we get that specific. I don't want to say the wrong thing, so I'd rather you just follow up in an email with that. So another one, Dr. Pasek, can you just review what the protocol is like to access medical aid in dying? So if a terminally ill patient came to you, what does that look like?
So the first thing that I'll say it step by step. So my office manager takes the call. She takes down your information and she asks you to sign over your medical records to me. Once I get the medical records, I can determine pretty much from the medical records whether you are an eligible case or not. And if you are not an eligible case, obviously we'll tell you. If you are, then you will get an appointment with me, and that appointment will either be in the office or via telehealth, depending on your situation, depending on our current COVID environment. And then we will spend about an hour and a half talking about your disease, talking about what your wishes are, answering any questions that you may have. And that visit constitutes what's called the first formal verbal request. I will be determining whether you are asking this of your own free will, if there's anybody pushing you to do so. Sometimes I will, if I suspect that, sometimes I will ask to speak to you without your significant other in the room or present. I also assess whether or not you are able to take a glass of liquid and put it to your lips and drink, because you need to be able to self-administer the medical aid in dying medication. Nobody can do it for you. Of course, you'll be showing me proof that you're a resident of the state of New Jersey. Your medical records will tell me whether you have a terminal illness or not. And so once you meet all the qualifications, I will then arrange for a consultant visit, and I have a network of people that will consult for me. So again, goes back to my office manager. My office manager makes that appointment for you. She will also send you the form for the formal written request that needs to be signed by you and witnessed by 2 other people, one of which can be a family member or a spouse, and the other one has to be a completely neutral person that does not stand to benefit financially from your death. After you see the consultant, you'll see me again. It has to be a minimum of 15 days, and usually we can get that appointment in within 15, 16 days. So there's not any kind of lag or wait time to get to see me again. And we go over everything again. Again, this is now your second formal verbal request. I go over all the rules as to what you can and cannot do. And I answer all your questions. I explain to you in detail all the medications that are involved, because there are 4 different medications plus anti-nausea medications that are taken. It's not just a pill or 100 pills of the same kind of medication as it used to be. I will tell you about the pharmacist that we work with and what the protocol for picking up your prescription. And I will remain available to you for any questions you may have at any time afterwards. I'll be telling you that you're not obligated to take the medication at any time. You can just shelve it and never use it. And if you wait many months and you decide you want to take it and you can't remember anything that I just told you, then we'll have another phone call and I'll go over it again with you. And I'm just there to support you until the end, whether it's a natural death or whether it's with medical aid in dying.
Thank you for that. So a couple of questions that I think we can answer relatively easily. One person said, I guess we shouldn't assume that any hospice in New Jersey would connect you or have on staff a physician who can prescribe medical aid in dying.
Correct.
Just because someone is on hospice doesn't mean, that they're definitely going to have someone there that would prescribe this. It's much more of a lengthy process, as Dr. Pasek just laid out.
And there are hospices that are not in favor of participating with medical aid in dying. So I have a list of hospices that are very supportive, and I have some hospices that I urge people to stay away from because their lives are going to be made more difficult using that specific hospice. So
yeah, so I'm gonna and then another quicker question I think we can answer. Are you experiencing the trend of religious hospitals taking over secular hospitals and then not allowing their doctors to provide medical aid in dying? I haven't seen that happening, but Dr. Pasek or Debbie, I'd love to hear from you if you've seen that sort of thing happen in the past year.
Well, I'm an independent practitioner. I'm not an employee of any medical system. So I don't have to answer to anybody, which is advantageous. Unfortunately, there are some institutions that are religion based and do prohibit their employed physicians from participating. There was a case out in Colorado that made the news of a physician that she wasn't even fully employed by the institution, but she did have some affiliation with it, and I mean, she was salaried, so in some way, and she was dismissed. She was fired because she elected to help a patient. So it's individual. I don't know if I have not come across any issues.
Yeah, I don't think we've seen an uptake in, for example, Catholic hospitals or religious-based hospitals buying other hospitals at this point to sort of drive out the use of medical aid in dying. We haven't seen that. No.
I think you need to just be aware. So when coronavirus hit, I decided that when I get a chance to actually see my medical doctor, the first words out of my mouth when we sit down together in her office is going to be, how do you feel about medical aid in dying? Because I don't know how she feels about it. And if she is not going to be on board with it, and it's something that I definitely am going to want, then I know right now I need to change my doctor, because I need a doctor who's going to support what I want when I'm ready to do whatever it is, if I need to, down the road. Just like that with a doctor, it's the same thing with a hospital. If you're interested in availing yourself of the law in New Jersey, and your doctor is only affiliated with a hospital of religious bearing, you're probably going to hit a brick wall. You're not going to get what you want. So now, before you are anywhere near the end of your life, is a time to sort those things out and to be aware of it. Mergers and acquisitions occur in the healthcare world. It's heavy in northern New Jersey, a lot of mergers and acquisitions going on. Once an organization is taken over by another organization that's religious, whatever that religion is, their umbrella way of dealing with anything such as medical aid in dying is going to be different than other secular hospitals, and you need to be aware of that now.
Thank you. Those are good points. So I'm actually going to pause on the questions for a few minutes. I'm going to hop over and go over some facts that we learned from the Department of Health in the first year of implementation, and show you some of the resources that Compassion and Choices has available to you should you be thinking about making this decision, or you just want to work on end-of-life care in general. So I know there's a few questions on the chat box about how has the law really worked so far. Well, the law went into, it passed on April 12th of 2019, but went into effect August 1st. And about a week and a half ago, the New Jersey Department of Health released a report to let us know how the law worked from August 1st through December 31st. And at that point, in that timeline, 12 people had utilized the law. It was a 50-50 split between men and women. There were folks from ages as young as 50 and as old as 93, with an average of 71. 7 of those 12 patients had cancer. 3 had neurodegenerative disease, so maybe something like ALS is what we would often see. 1 of the patients had a pulmonary disease, and 1 had a gastrointestinal disorder. This data is very similar to what we see out of Oregon, who's had this law in effect for quite a few years now. And there was nothing alarming by what we saw in the first 6 months that caused us to pause. But as I keep mentioning, Compassion and Choices has really worked on a ton of resources for folks when they're doing advanced care planning and when they're in the end-of-life care area. So a few I just want to mention are on our website. We have a Plan Your Care Resource Center, and I'm going to go into that a little bit further. But there you can find a host of tools to finish a variety of things there that you can do, including the forms that you should fill out at any time. We also have a consultation service with end-of-life counselors, and we have a phone number and an email address. You can contact them at any time, day or night. You leave your name and your phone number, and someone will call you back within 24 hours, and they can help you shepherd through the process of medical aid in dying, or letting you know what other options might be available for you if you're in a state where medical aid in dying isn't accessible. We've talked a lot about COVID on this call. So the one tool that I really wanted to highlight was our Find Your Care tool. This allows you to search for hospitals and hospices by your zip code. And what it will show you is not if a hospital is willing to prescribe, because it really is on an individual doctor's basis, but it lets you know if they have a policy in place that would allow their doctors to prescribe. And we were really happy that coming up on the 1-year anniversary of the law passing, that there were over 40 hospitals and hospices that had policies in place that would allow physicians to prescribe, should that be something that they're willing to do. So I would really encourage you, if you're someone that is interested in medical aid in dying, or it's an option that you would want, to just go on there for 2 seconds and check and see if the hospital or hospice that you would be involved with would allow you to have that option. There's also a lot of tools on there about how to walk through the process and what have you. These are all patient-driven tools to help patients feel empowered at the end of their life. But the great thing about Compassion and Choices is that we also have resources for physicians and pharmacists. For example, we have a doc-to-doc program where if a doctor is thinking about prescribing this for a patient and they have questions, or they want to talk to a seasoned doctor, for example, Dr. David Grube, who is our medical director, who has experience in this, they can call and have a conversation. And that is a great way for doctors to connect and maybe feel a little bit more comfortable with the process. That same resources is also available to pharmacists. And we have a pharmacist to pharmacist program where a pharmacist could talk to another more experienced pharmacist about what it is that they're doing and what the current clinical practice and protocols are for filling a prescription like one for medical aid in dying. I was going to pause there and ask for a few questions. I know that we're getting close to our deadline with about 5 minutes left. So before I hop to that, I just want to mention a few quick things. We do have another webinar coming up on Tuesday, August 25th. We're very excited about this. It's actually going to be a rescreening of a reading that was done at the Whitney Museum by a supporter, Barbara Hammer. It's called The Art of Dying. And so if you are someone who is interested in art, Barbara presented this at the Whitney before she passed away last year. And so we're doing a rescreening of it. And her partner, Flory Burke, is going to talk about what Barbara's end of life actually was like compared to what she had talked and advocated for so long. You can see all of our webinar series at compassionandchoices.org/webinar series. And all of the webinars that we have done previously. Since the COVID pandemic hit, we really hit the ground at Compassion and Choices with a variety of webinars, and they are all available and recorded, just like this one will be in the future. If you don't follow us on social media, I would strongly encourage you to do so. We're on Twitter, on Facebook, on Instagram, and lots of videos on YouTube. It's the best way to stay up to date with what's happening, not just in New Jersey, but nationally. So if you're interested in knowing, what bills, what states are introducing bills, or seeing the latest articles that Susan Boyce is featured in, certainly hop on over to social media and make sure that you're following us. And of course, I'm going to get to a few more questions, but I just wanted to make sure I made a note to let you all know that we are funded almost exclusively by individual donors. With sufficient resources, we can realize end-of-life choices in every state. Every donation really, truly makes a difference. We know what we can do when we have the resources, and we were able to pass a medical aid in dying law in New Jersey. We've been able to defend it in New Jersey because of our donors. So we thank you and encourage folks to consider making a donation today. But now, I'm just going to hop in and see if I can answer a few more questions as quickly as possible. Can only physicians prescribe medical aid in dying? Yes, only physicians can. So that was a quick one. we will see. We already answered that 12 prescriptions were used between August and December. Debbie, are there any provisions of the law that you'd like to add?
You faded out that I would like to what? Or Dr. Pasek?
Add or change?
I think personally, I think the law is protective of the people who are availing themselves of medical aid in dying. I think it is protective of the physicians who participate in it as well. I think the law is well written. I've read it deeply and I'm presenting on it to a hospice group actually on Thursday. So I'm very well versed in it, and I think it encompasses every piece that needs to be talked about. We didn't discuss the whole thing in great depth at all here, but the law is available. If you Google it, you can see the law yourself. A lot of lawyerese talk, lawyerese speak, but it is well-rounded, and it protects anybody involved, which is a very good piece of it, because nobody wants to be, the rug pulled out from underneath them. So there's nothing that I would add to it. No, I think it's a good law.
Anything else that anyone would add or change to that? Great. So the last question that I'm going to ask tonight, well, I'm going to answer one and then I'm going to ask one. Sorry, it's so hard to not answer these questions, guys, but I hope you're getting all of the answers. What was the stance of the New Jersey Medical Association? Were they neutral? They were not. They have been opposed and they are still opposed. So although we would love to have them on board, unfortunately we know that some of the medical associations just aren't going to be. What we have in our favor, I think the New York State Academy of Family Physicians were supportive, as well as the National Academy of Family Physicians. And so we were able to find some New Jersey family physicians that were supportive as well. And thanks to Dr. Pasek, we were able to get quite a few physicians when we needed to. But the actual medical association in New Jersey was not neutral, nor are they now. The last question I want to ask everyone, what kept your spirits up during this long fight?
For me, it was my husband. I did this in honor of my husband. I know that if he had been around when this law was passed, he would have absolutely availed himself of the law. So I did this with him completely in mind. And now I think about myself. I'll be getting older and who knows what's going to happen to me. I have children. My children have children. And so I think that it's something that should be, as Assemblyman Berticelli said, something that's available. And for those few people, because it's really a small number of people who are interested in it, who also meet the criteria for it, but like 1% of the people who actually meet the criteria go through the whole process. It's just a choice. And it's just there for you if you want it. If you never use it, that's fine. So that's what I have to say about it.
For me, I think it was getting to know the other people I was standing in hallways with. Part of this process is you spend a lot of time in the State House waiting for things to happen, hoping to get somebody who's walking by who will listen to your story. But the rest of the time that you're standing in those hallways, you're standing with other people who care about this issue as deeply as you do. And that's that, and the Compassion and Choices team, who have been across the board just amazing, wonderful people to work with. That's what kept me going. Every time I said, okay, I'm done, I'm tired, I'm sick, I don't want to go out anymore, then I'd get a call from Corinne, or I'd get somebody would do something, and I'd say, oh, of course I'll be there. And that's what it needs to be able to pass something like this, is it's becoming a team and sharing the passion and figuring out how to share the load, because honestly, it's a long push. Unmute, Dr. Pasek. Unmute.
Sorry. I actually joined the team in January of 2019. So I was not part of the long haul as others were, but I coincidentally, I was trying to join an advocacy group for several months and just couldn't find a phone number or a connection. And I found Corinne Carey's phone number on something that that was published on the internet, a speech that she had given in New York. And I said, a phone number. And I called the number and Corinne picked up immediately, and the rest was history. And a month later, I was testifying before the Senate. So it was very quick for me, and it was such an honor to get to know all of the advocates that I met in such a short period of time, hanging out in Trenton. But I wish I had been there all along, actually, but better late than never.
Dr. Pasa came in fierce and hot and was ready to close the deal. So it was definitely great to have her on board, as it was all of you. Again, I would like to thank everyone for joining us tonight, especially our panelists, as well as Assemblyman Berzicelli. Without all of you, I don't know that we would have a Garden State with a medical aid in dying law. So the deepest appreciation for all of you. We are always available at Compassion and Choices to answer your questions and help you. There are still plenty of ways to help us, whether it's by a donation or advocating with your own physicians and medical groups. The fight still continues to ensure equal access for everyone, as well as ensuring that providers are close by for everyone. So if you want to be involved in the campaign, we can still keep you busy. But thank you all so much for spending your evening with me. I appreciate it. I appreciate your support, and I look forward to seeing you again.
Thank you.
Have a great evening, everyone.
Thank you very much. Good to see you.
Bye-bye.